All right, moving on, disrupting the healthcare industry. In an exclusive interview with Yahoo Finance's editor-in-chief, Andy Serwer, Berkshire Hathaway CEO Warren Buffett weighs in on Haven. Take a listen.
I didn't worry about a name. We could have gone on as a no-name operation for 10 years, as far as I'm concerned. No, that is, we got a wonderful partnership in the sense that it's large and has reasonable market muscle with more than 1 million employees among the three of us. We've got 3 CEOs that can make things get done in organizations that are so big that normally they would get very bureaucratic. If you tried to do this with many big companies, you'd have legal weighing in and public relations weighing in. We don't have any of that stuff. They may have them in certain areas, but I don't have to. But Jamie isn't going to worry about doing that sort of thing, and neither is Jeff. So we've got a unity of commitment and an ability to execute on the commitment. The only problem is you've got a $3.4 trillion industry, which is as much as the federal government raises every year, that basically feels pretty good about the system. As we went around talking to people to find a leader for the group, for example, everybody says, the system, it turns out very good medicine, but you can't go from 5% of GDP to 18, without really making you less competitive, among other things in the world. So everybody thought the system needed some adjustment, just not their part of the system, and that's very human. I'd do the same thing, I'm sure, if I was in the same place. So there's an enormous resistance to change, while a similar acknowledgement that change will be needed. And of course, if the private sector doesn't supply that over a period of time, people will say then, we give up, we got to turn this over to government, which will probably be even worse.
How often do you talk to Jamie and Jeff about it? I know Todd Combs, I think, is your point person.
Todd really does all the work at our point. If this works, give Todd 100% of the credit from the Berkshire standpoint.
Does Haven have to buy companies to gain expertise? And what do you?
No, no, I don't.
What is the plan? I mean, how do you?
The plan is to support a very, very, very good thinker on this subject is a practicing physician and who commands the respect of the medical community to, in effect, figure out some way so that we can deliver even better care and have people feel better about their care too. I mean, they have to perceive that they're receiving better care over time and stop the march upward of cost relative to the country's output. We've got this incredible economic machine, but we shouldn't be spending 18% when other countries are doing something pretty comparable in terms of doctors per capita, hospital beds per capita, and all that. The very top stuff in medicine, I think, is very much concentrated in this country, and that's great. I want us to be the leader, but I just don't. I think we're paying a price. If we're paying 7 extra points of GDP, that's $1.4 trillion a year.
Is the administration focusing on drug prices? Is that sort of a rabbit hole? Is that missing the bigger picture?
I mean, they're trying, and Congress generally. I mean, if you talk to the average congressman, they regard it as a problem, and they see specific instances, of drug prices or something like that. But it's a big problem to change. I mean, the trouble is it intersects in so many ways, and that's why we've got Gawande heading it, and we've got 3 big-sized organizations backing him. We're not trying to do it to make money. I mean, that is not a goal that we end up with some business that we make money off of.
And will he be talking to health insurers, for instance?
Well, he'll be talking to everybody, but his game plan is not something we're going to try and lay out because it's in his head to some degree. I mean, obviously we selected him by hearing and reading and so on what he's done, but he'll learn as we go. We will conduct certain experiments, or he will, and try out a community where one of us has a lot of employees, maybe. And there's various ways to experiment.
Stay tuned to Yahoo Finance's exclusive live coverage of the Berkshire Hathaway shareholders meeting Saturday, May 4th, 9:45 a.m. Eastern Time.